So, I am here with Dr. Sonza Curtis, who's a colleague and a friend, and we're here to talk about what inspired her. Well, first of all, what inspired you to start your naturopathic journey? I know you were a PA and in ENT and various other things, but what made you decide to go into naturopathy?
Well, it's an honor to be here with my friend Lisa, Dr. Lisa,
Yeah, it's
Dr.
okay.
Lisa. Here I go
We may
again.
call each other by our first name, so it's okay.
Okay, Dr. Lisa. Well, the first thing that inspired me was my great grandmother were both herbalists and midwives. So I grew up, I was detoxing before I knew what detoxing was, right? I was taking cod liver oil, castor oil, all those things. And I just thought that was nasty stuff that your grandma gave you. I thought everybody did that, right? So when I went to PA school, I just got tired of, once I graduated, I got tired of giving an ill for every pill. So I started looking into natural things because of my own health and my family history. I had high blood pressure since I was 17. My dad
Wow.
died of a massive heart attack. Um,
Wow.
Mother had was recently diagnosed with multiple myeloma at this time. And so I myself was searching for answers. And I started dipping and diving. And then finally I was like, no, if I'm going to do it all the way, I'm going to go all the way. So I went back to naturopathic school. And boy, was my mind blown because I was like, Grandma really know what she was talking about, right?
Yeah, exactly.
That
Exactly.
fat lowers omega-3 fatty acids, right? So that was my introductory, and I don't look back. I'm so glad that I did.
It's funny because you and I, even though we grew up in different areas, have similar things. But anyway, so you got into naturopathy, and I met you when we both did IFM and got into functional medicine. And but you have recently, or maybe not so recently, got interested in addressing hair loss naturally, which I think is quite unique because I don't think many people are doing that. So what sparked your interest in going down that road?
Oh, well, one day it was a typical, you know, day, and this beautiful young lady came in and she just said, Dr. Curtis, you have to help me. She was in tears. She was wearing a wrap. And I'm looking at what's going on with you. And so when she took off her wrap, she had said she had been to multiple dermatologists. And by going through those dermatologists, they kept giving her medication. It wasn't working. Her scalp was irritated. She was bald in areas. It was
Oh, wow.
bleeding. It was a really horrific sight. I mean, it was like I felt her pain. And I looked at her and I told her, I said, I don't know if I can help you, right? I said, only thing I can do is apply what I know, those simple functional medicine, practices. And unbeknownst to me, she responded great. We cleaned up her gut, we fixed her metabolic issues, and we did some topical, and her hair now looks like mine. I mean, she was
Oh,
bald.
wow.
Yeah,
Wow.
if you go look on my Instagram, I'll tag this, but her hair is like phenomenal. And she made a change because she was a teacher, and now she's changed to be a nutritionist because of her experience. And so that's, I didn't find it, it found me. Guess
Oh, wow.
answer to your question.
Okay, do it again. Wow, that is impressive, Dr. Curtis. Now, you mentioned gut health. I think that's kind of interesting. How does gut health impact hair health?
Question, Dr. Django. Sounds like the patient when she was on the table. And thank you. Like I tell all of my patients, it's, you know, doctor means teacher, right? So we just teach them how to tap into their innate ability for to heal itself. Well, when she was sitting on the table, she says, I said, well, we're going to start with gut health. And she says, what does my gut have to do with it? And I looked at her and I felt like Tina Turner, like, what's good got to do with it? What to do with it? Right? So I told her, I said, sweetheart, everything. I said, that's where all inflammation starts. That's where all your nutrients get absorbed. And if we have to start healing, that's where we have to start healing at. So if you're taking medication, supplementation, if your gut is not optimal and for hormone balances, that's where we have to start. And so I went back to what, we know naturopath 101 is gut health. And it had a lot to do with what was going on with her.
Great, great. Now, what do you find for the people who come in with hair loss in your practice? You mentioned the gut health, but what are the most common underlying causes? I mean, we talked about inflammation and, that's a big topic. We can talk more about that because it relates to what I do too. But what do you find are the most common things that you see that are causing the hair loss?
Like you said, underlying inflammation, but mainly autoimmune. This young lady had lichen planopilaris, which is an autoimmune disorder, right? So it's basically her body was fighting itself and it was attacking her hair follicles and causing them to come out, right? So,
Wow.
um, and there's others that's out there. And then you can have, you know, hormones with male balding. And there's a lot of myths out there that if you wear a hat, that causes hair loss, but that's not true. The other thing is hormone imbalances, like either overactive thyroid, underactive thyroid, um, menopause, perimenopausal,
Mm.
too much too much testosterone, PCOS, or elevated, increased DHEA, so and DHT. So there's a lot of hormone imbalances there. And the big one I think we really overlook is nutrients deficiency. I know post-COVID, a lot of women were having, or women and men were having hair loss because COVID was really robbing of the peripheral areas with the scalp and the fingers and causing the nutrient deficiency, which causes hair loss. So, and your good old standard American diet. Okay, there you go.
Yeah, yeah, there you go. That's a big one. So, what would be the early signs? Like, how would people know that? I mean, certainly they notice hair loss, but is there anything that they can look for that may be at the beginning of that, or not?
Usually you'll see a little extra shedding, it all depends because people lose, there are 50 to 100 strands of hair a day. So if you're wearing a protective style where you have a wig or something underneath it and then you take it off, then you have to think about how long have you worn that protective style and is the hair loss excessive? So you would watch it for a couple of weeks, for a couple of days, about a week or so, and see if it's excess and start seeing thinning. I think that's the biggest thing I get when people start see thinning, and if the scalp this irritated and red, and even sometimes you can see some bleeding in the area where it's really, or flaky, that type of thing, and they'll think it's like, oh, it's nothing but dandruff or something that I use with hair care products. So that's the most common thing that I get from patients before it gets to that, voila, I'm bald.
Yeah, yeah. So, what can people do? Like, can they that at home that they can to improve their hair health, like lifestyle stuff?
That's a big one. It's really watching, nutrition and lifestyle. Stress is another big one. You stress can really cause hair loss. And I think a lot of people think once the hair is gone, it can never come back. Everybody's totally different. I don't tell people your hair is going to come back. The whole thing is we're going to get you healthy, and we're going to get your scalp healthy, nourish your scalp and your microbiome, and that should help with generation of new tissue and new hair follicles, and then it can grow. So eating proper is one thing, and stress reduction. And who isn't stressed these days, right? People come in, I'm
Mm,
like, oh, stressed. And I'm like, yeah, you got your own job, you got divorced, you just moved, da 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 da. And I think we underestimate the power of stress.
I agree.
And yeah, they always like, we all learn to adapt to that stress. And the other big one is what we put on our skin, uh, toxins, right? By the time a woman walks out the door, if she puts on makeup, puts over 300 plus toxins on between our
Wow.
hair care products, or our makeup, all that stuff is what we walk out with. And no wonder, these things are endocrine disruptors. So that means it affects your hormone production, it affects your thyroid, it affects all those things where you have weight gain. I use an app for my patients. I tell them to use it. It's either Think Dirty or Yuka, and you can scan your hair care products, and it'll tell you just how good, bad, or indifferent, or if they're, a thumbs up. So that's a good
What are those again? Think Dirty
Think Dirty,
and
Yuka.
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 Okay, and those are apps that people can download.
Download, and they're free.
Okay, perfect. That's really interesting. So there's so many things out there. Like you see so many things to about that people can buy to, help their hair grow. But what do you think are the top three, well, I would say natural remedies or supplements that people can do to promote hair growth?
A good multivitamin, biotin is good. Making sure your vitamin D, that's very important for inflammation and your immune system. And just making sure you get checked for vitamin D, your hormones, making sure they're up to par. And again, the hair care products, massaging your hair, making sure that you wash your hair, and you do those styles. Like, you don't want to pull your hair, you don't want the
Mm,
traction. If you're losing hair, you don't want to put your hair back in a ponytail, right? Because
mm.
you can develop traction alopecia. So just protective hair and making sure your hair dries very well, and keeping it moisturized and the scalp healthy is one of the biggest things there.
So, okay, great. Are there any advancements or anything that you're seeing with holistic hair care that you are most excited about?
I'm so glad you asked, Dr. Gengo. Now we're talking. Yes, there is, which I'm incorporating into my practice, there is a pharmacogenetic test. So what that means is, where basically you take a cheek swab and you get your DNA, and it tells you basically which drugs will be best based on your genetic system, not only drugs, but topical, but also like nutrients and those things. So if you want to do the natural route, they have that available. And if you want to do the medical route, they have that available. And with that, you're seeing more, the hair grow back faster, because it's not a cookie cutter. It's not minoxidil for everybody. It's not, dutasteride for everybody. And so it's based on your genetics. The other thing that we're finding a lot is PRP. So that's plasma rich protein, where you actually take the blood from, you draw blood, phlebotomy, you take that blood, you spin it down in a special centrifuge, and you inject that into the scalp. And that stimulates collagen. So now you have hair growth. They're also using exosomes. And this is a big topic with everybody, because everybody, it's Wharton jelly, it's coming from, where it's coming from, fetus and all of that. But they have exosomes, and they also now have plant exosomes that you can either apply to your scalp at home, or it can be injected. And for those people that are really, really sensitive, like my patient that came in, you don't want to inject with that, because that's going to increase more inflammation. So sometimes you can rub it on, and they have this new device. It's called the Target Cool. I can't wait to get my hands on one of those. So it uses cryo, and cryo infuses it into the scalp, and also ultrasonic waves. They're using that as well with low light laser, the laser therapy, and peptides.
Interesting. Interesting. Wow. So how can our audience like get more involved, or you mentioned all these really great things, and I know you have a program. It's called the Holistic Hair Reboot Program. And how can they get more involved or learn about that and learn more about your work that you're doing?
You can follow us on Instagram. We're very active on Instagram, and our handle is three, and that's spelled out THREED wellness underscore GA. And we'll have our updates on there. And we're soon, like you said, thank you for that. We're launching the Holistic Hair Reboot program, and we are looking for participants to be in our first cohort. And if you're interested, you can DM me through Instagram, or you can contact me through my website, and that is 3dwellness.com. And again, that it looks like three. People always, when they call us, it's just 3D Wellness. I'm like, no, it's 3D Wellness. And those are the two best things. You can also call the office, and our phone number is 678-621-8100. And we are in the great ATL Hotlanta area, out in the suburbs. And if you want to come down and do some of these therapies, you can. And yeah, you just have to see me once a year, and I can prescribe and I can do those things. And the cool thing I have a microscope. I can't even get it out. I'm so excited. I have a
Yeah.
microscope because, it takes 120 days for actually see some, hair growth, right?
Mhm.
But I can look under the microscope and I can tell how healthy are you responding to therapy before you actually see hair growth. So that's pretty cool and exciting that you can watch it real time.
So your program, how long is it?
It's a 12-week program, and then we switch over into a membership. We just kind of get you prepped and get you started on the program. We have health coaching. We have different things that we identify, like some of the things that I said earlier. What is your issue? And we have it's consisted of one-on-one as well as group. And it's exciting. And everybody that's come through, Gia, the young lady that is also the nutritionist for the program, she's walked the walk and she's talked the talk.
Yes, I actually know one of your patients, and she happens to be a patient of mine, and she's done very, very well, and she's extremely happy, and her hair is still really good. So I know the program works. Well, it's great to talk to you. And everybody, please contact Dr. Sonza Curtis and learn more about her Holistic Hair Reboot program. Thanks.
Thank you.